Okay, welcome everyone to session 2 of our learning network on building HPET programs and doing the financial planning for that. I'm Alex Rohlwing, same as last time. I haven't changed. My background has, sorry about the backlighting. I moved to a new place and haven't quite figured out my presenting situation yet. But that'll just force people to really focus on the slides instead of me, which is great because we've got a lot of good information to go through today. And as always with webinars, we all know the deal. You're welcome to, throughout, if you have a question, put it in the chat, and then later we'll have some time for questions when people can unmute and everything. We'll also be going into some breakout rooms today, so you get to speak with your colleagues some and share with them. And I am, of course, here on behalf of the Association of Clinicians for the Underserved. And ACU was started about 25 years ago, and we help out people across the healthcare board throughout the US. And specifically within that, we run the STAR Center, which is our National Training and Technical Assistance Partnership funded through HRSA. And the STAR Center provides free resources for health centers, just like this webinar that we're doing today. And here's the lovely STAR Center staff. And so please reach out to any of us if we can help you with anything recruitment or retention or workforce development related. And today you will have me with you. Helen is still enjoying a well-deserved vacation. And behind the scenes, we've got Mariah Blake. And so please reach out to her at just through the chat if you have any technical issues today, or if you need anything at her email address, mblake@clinicians.org. And while I'm thinking about that, one of the things we did have was some issues with the discussion board, some little technical challenges. And so if anyone had trouble and wasn't able to get onto the discussion board and still is not able to after today's session, please just send Mariah or me an email, and we'll make sure you get set up and get access into that. All right. Okay, so what are we going to go over today? Let's find out. Today we're going to look at how you understand and estimate the value of the impacts of building an HPET program, and how do you do that financial planning piece. So we're really going to break down into a lot of the details today. We don't have a guest speaker, it's just me for the whole time, but we're going to really dig into the nuances of that planning process, and hopefully get you started on the road to really completing that financial plan and being able to go through it piece by piece and have something really holistic and encompassing put together when we conclude this learning collaborative in June. So I think today is going to be a really good day. We're going to start out today with a breakout room. Hopefully you were all able to go through the coursework from last time. And I would just like to give you all a chance to discuss that with your colleagues. So specifically thinking, what roles at your health center did you find have the greatest shortages or are the hardest to source candidates for? So what's your biggest recruitment or retention challenge? And then along with that, what type of health professions education and training program would most benefit your health center? Or if you already have one, have you started to see benefits from it? And how would you like to improve and grow it to add those, to multiply those benefits? So Mariah will sort you into breakout rooms, and I will go and I'll paste these questions into the chat in each breakout room, okay? Welcome back, everyone. I hope that was good discussions from what I heard. It really was, and I think that we are going to dive into a lot of the challenges that folks brought up today in the breakout rooms. And as we go through this, we're going to today walk through kind of the entire financial planning and assessment process. And then as we go forward in future learning collaborative sessions, we're going to kind of look at building programs that work with either different types of funding or try to work to build programs suited to specific career types. So that might be building a program that brings in nurses, or one that trains MAs, or one that works with graduate medical education, so residents, and then also looking at some of the things like external partnerships and stuff like that. So we'll kind of dive into each of these separate categories further down the road, but today is an overview for the whole process. And before we jump in, I also wanted to say there's going to be a lot of information on all of these slides. There'll be some tables and everything to kind of help you with doing these assessments and this financial planning. And there will be on the discussion boards available a PDF of not just the slides, but the detailed notes that go along with them. So while the slides are more visual, there will be all of that information available to review on the PDF breakout. All right, so let's jump in. So the first thing we want to think about is kind of that assessment. And that's the first part of what we did before, what program would be of greatest benefit? Because obviously, if you're going to put in the effort and time and money to build an HPET program, you want it to provide you the greatest benefit possible as far as your recruitment and then also staff development and retention. And as we do this assessment, to really get into the details, we want to look at internal resources. So those are ones we have within our health center, and then external resources. And these could be still linked to the health center, so say your PCA, or these could be, out beyond that. So say an educational institution that is in your region that can supply learners for, say, clinical rotations and things like that. Or it could be other parts of the community, right? So you want to start an apprentice type program for medical assistants. You might look at, are there high schools that are interested in having vocational training programs and things like that? So thinking and really trying to think in as broad a box or outside the box as much as possible as far as what could these external resources be. And they could include community resources that are outside of the traditional medical sphere. And then we also want to think about timeframes, right? What kind of time frame are you looking at? Any of these programs, as we build them, you will start to see really good returns as far as staff recruiting and retention and everything, but those can take a while to ramp up. And we want to make sure that we can sustain the program. It's sort of like starting a business, right? You need a certain amount of money to start a business and to be able to maintain it until it becomes profitable. And it's a similar thing like this. Do we have both kind of the finances, but also the internal and external resources, say the staff time and staff interest in building up one of these programs, because we don't want to do it at the cost of our staff, say if we're putting too much of a burden on them. So we're going to talk about assessing all of these different needs. And I built out some tables, and in your coursework for the end of this session, and then future sessions, you'll also have access to these tables in a Word document. So if they're useful to you, filling these out will help kind of build out that plan and doing some of this assessment and planning. So we look at this program assessment table, and we're looking at staff roles with greatest shortages and, kind of looking at them over time, because we want to see those trends as well, right? Because we know that trends are always changing. And so you might be, you might have 15 years ago had a lot of trouble recruiting physicians, and in the past 5 years your bigger shortage has been in medical assistants, something like that. So you may want to kind of pay attention to these trends and try to see like which direction are things going, so I can really focus my efforts going forward with the recruitment and with how I'm building that HPET program. And then we also want to assess things like, any notable trends that we see in UDS data or some of these other data sets that we might have available publicly or through our PCA. I know some PCAs do surveys and everything and provide a lot of data on that. And then also talking to our staff, right? If you're going to start a training program, you're going to need staff to be available to train, or you'll have to bring on training staff. And so you want to see if those resources exist. And then as we're going through any of these resource assessments, this is an equation that was told to me a long time ago by a retired military general, and it's very simplistic in one way, but it's basically resources, what do you have, minus your requirements, and that equals either a surplus or a shortfall, right? So if I know that I need 3 staff to run my HPET program and I only have 2, then I'm missing a staff member, so I need to resource that somewhere. So this is just kind of a first step to problem solving, right? And your ultimate plan is going to have to fill in any gaps or shortfalls that you see. And the thing, if you find surpluses, is that is often something that you can use when you are trying to work with a partner, right? So as you're building that partnership, negotiating that, when you have surpluses, that usually means that that's something you could offer, right? So if I have, lots of, say, clinical space or lots of staff that are interested in doing this training part, maybe I can take on more students, rotating through more learners. And so that's a surplus. So that's something that I can, or we have a really large patient population. Again, that can be something that can be enticing to a potential partner. We can provide lots of patient interactions to clinical students rotating through, and you can start to negotiate how's that partnership going to work out and support both your needs. So as we're going through our internal resource assessment, thinking of what do we have, what do we need, and then do we have shortfalls or surpluses, we're going to look at things like leadership support, right? You need leadership buy-in at the health center, and you all are in various leadership positions, but as you know, leadership is not always completely unified, so you may have to talk to other people and kind of figure out like, okay, where do we need to come to agreement on things before we move ahead? You have the board of directors for your health center. You may need to talk to them and kind of figure out how you can move forward on this program together. Also looking at your patient population, right? Is your patient population going to ultimately benefit from this? And obviously providing, more staff and greater diversity in staff and having them be highly trained and really having that training tailored to your health center's environment is probably going to positively impact your patient population. But that's something that, given our mission as health centers, we obviously want to keep in mind. Potential community interest, right? If you have this as a resource, that's something that can be really powerful. If you have an organization within the community that's willing to partner with you, that can be exceptionally valuable. Training space, right? Do you have the space in your health center, or is that something is that a resource you're going to have to source elsewhere? So you're going to go through this list and checking off, do I have these things, or is this something that I need? Financial resources. Again, looking around, some states provide funding for different types of health professions training. Sometimes there are grants that might go to an educational institution, so you might have to form a partnership to access that. But, do you have funding sources, or do you have even donations? And these can include things like maybe retired staff that are willing to come back and donate their time supporting a training program, right? So kind of thinking through these things and trying to think as expansively as possible about them. We move on to do the same thing with our external resources. So what potential external resources do we have? Are there higher level educational institutions, or are there high schools or community colleges that might be interested in partnering for some sort of a training program? And you can even start off with just, going out and engaging with the students and saying, here's what health centers are, here's how you work with one, and then build up to a more formalized program where you might have people rotating through to gain specific clinical training. But kind of thinking about all these resources. Other things might be, colleges or universities that have job boards. A lot of times they're very happy to advertise jobs, and sometimes you can work with them to see, well, if this is someone who has recently graduated with, say an associate's degree, and they might be looking to get into the healthcare industry, they might be interested in coming to our MA program. So when you do build out your program, you're going to need to promote it and get learners actually coming in. And so these can also be opportunities to promote that program for basically the advertising for it. And then also looking at what might be considered traditional competitors as outside resources, where you can form partnerships with them. And this could even be other health centers or other hospitals. And it can be hard sometimes because, especially when we're in steep competition for staff, it can be hard to think like, how can we build a collective win out of this? But sometimes you really can form valuable partnerships with people and say, look, we both need this type of clinical staff. So let's start a training program where we can build them up, and we're going to figure out some process to share the benefits and the costs of that. Again, do you have a PCA or an area health education center that has valuable resources and people to help you? Obviously, the NTAP, so the STAR Center, is happy to help you with it. And you can go to any of the NTAPs to address different things. There's external organizations, accrediting bodies, right? They're going to have lots of information, especially if the program type you want to build is something that requires accreditation. And sometimes that can vary by state for something like medical assistants, right? Do they need to pass a state exam to start working as a medical assistant? So you may need to gather information on that. So thinking not just physical resources, but also information and people who can help you through processes. And so again, just trying to keep these things as simple and as kind of brainstormy as possible is just doing something like this, like internal resource requirements. What am I missing? What don't I have within my health center? External resource requirements. What's missing? What don't I see that's real obvious outside? Maybe there's not an educational institution anywhere around my health center that could potentially loan students. So I may have to be creative and find another way to bring on learners. So I might have to just bring them on directly from the community, or I might reach out to places that I know send students further afield. Say like a physician assistant program will oftentimes send their learners over much greater distances to receive their clinical training, things like that. And you put all those potential options for working around it in that workaround area. And that's, again, with brainstorming, just start thinking like any possible solution. And then later you'll go and analyze it for, all those levels of practicality. So financial, do we have the staff time, the person power to be able to execute this, those kinds of things. But when you're starting out, just put down everything you can think of, and then you can go through and narrow it. All right, then we talk about the time frame assessment. So again, we want to think about how long is building out the program going to take? How long can we sustain it before we start having people finish their training and actually coming and joining our workforce to where we start to see those payoffs? And how long might it take to train up our staff, right? You want to have staff that are willing to teach, but you also do need to do some train the trainer, right? Teaching and instruction is a learned skill. And so you can have extremely skilled providers, but if they aren't given at least some basic training on how to be instructors, that can slow down a program's productivity ramp up. So you want to think through things like that. Like, what are we going to have to do for that? They may even have to gain some certification to train, right? It depends on what kind of clinical learners you're going to see, but sometimes a clinical instructor has to be certified to take on learners. So looking at those kind of things. And then also, if you have funding coming from a specific source, are there timeframes attached to that, right? And that may accelerate your timeline or allow you to spread it out and have more time to ramp up just based on, say it's a grant, when the grant deliverables are due. So as we get into the details of assessing costs, after we've made these generalized assessments, we're really going to focus in on how to gauge the costs. And these, again, can get very, very nuanced, and it'll depend on your program and kind of what your assessment of your own flexibility is and of your own needs. And then also, again, reporting for what your different income streams are, right? You may need to have very detailed reporting for certain grants, or that might be looser than reporting for, say, like if you're using money from Medicaid reimbursements and things like that. So you want to go through that and really think about all of these costs together. And we're going to break them out. We're going to look first at staff costs. So staff costs, again, we can't just take a full-time staff. So let's say that we're going to bring nursing students through on clinical rotations. That's going to be our HPET program for this example. Well, I can't just take our nursing care coordinator and say, you're doing your full-time job, let's add on training on top of it, right? We're going to have to dedicate some of that person's time per week to this training. And that may mean we need other coverage, right? If you have multiple staff who are going to be training learners, their productivity is going to decrease slightly as far as number of patients they see. So we need to bring on additional staff to kind of make up for that and cover it. And figuring out exactly how much additional coverage you need will probably be something that you'll make an initial estimate. And then as the program is going, you'll kind of reassess and fine tune that to make kind of better long-term predictions. But basically, the easiest way I think to think about it is either in portions of a full-time equivalency or just hourly. So you break down how much am I paying that person per hour, including benefits and overhead, and think, okay, how much of their time am I going to take per week to participate in this program, right? If they have a really in-depth role, like they're helping to build the curriculum, or they're really managing learners, or they're managing multiple trainers and things, probably going to be more time per week than someone who is, say, taking a student through, kind of their clinical shift for 4 hours a day, twice a week, right? So you're going to take out how much time is each staff member involved in this program going to be dedicated to this program, and that's their cost. And then you'll also need to backfill any kind of work that you're taking them away from and figure out those staffing costs. And so these tables take you through that. Then if we have costs associated with our learners, right, our trainees, they may be coming on, some programs, they are able to, say, hire the trainee as kind of one entry-level staff position. And then that trainee is going to go through their training, say, to be a medical assistant. And then once they're certified as a medical assistant, they move up and, receive higher pay and take on those duties. But they're hired through that process, and they kind of do half work, half learning and everything. Other places aren't able to do that. And so they say, nope, you're receiving your training from us. And then afterwards, we may hire you. And so their costs per trainee may be less, but you want to factor in any costs like that. These can also include things, and we'll talk about this in a little bit, but resources that you are going to use on these trainees. So say everyone gets a stethoscope, right? You have to factor in the costs for all those stethoscopes. And going along with this, we also have facilities costs. And this is one where I think there's probably more flexibility, right? If it's space that you already pay for and you just have some extra space that you weren't using, and you can kind of flex around the time that you're going to have learners in that space and everything, then you may not need to count that cost so much towards the HPET program. But obviously you could, if that, helps with kind of funding allocations and everything. But basically you would go through all of these costs that contribute to your overall cost per square foot for the facility space you use, figure out how much space you're going to be using for training. Say you're using a conference room, I think in this one, it was 1,000 square feet of facility space was what I estimated for a training program, because you need, that space to teach your learners away from patients and everything. And so we're going to have that much space for about 20 hours a week. So you go through and do these breakdowns of, what's the least cost per square foot, the utilities, things like that, data, so like internet and phone and everything. You just break that down per square foot of the facility, and usually facilities will already have these costs broken out. So you can probably just find, like, what does our facility pay per square foot of space each month? And you can figure out what your cost per square footage of space you're dedicating to your learners is. And you can factor that into your program if that's appropriate, right? If you're just using some otherwise unused office or conference room space a few hours a week, this may be more detailed than you need for that initial plan. And then we talk about supply costs. So like I said, you may need badging or access credentials for learners if they're coming in. You may need office supplies or, a budget for printing materials for learners and things like that. And, any equipment for training them, right? Especially if you're going to do something more detailed, like say training phlebotomy, you may have those artificial IV arms where people can practice doing blood draws, so their first practice isn't on a real person, right? So you may have training supplies like that. But basically for supply costs, it's anything that's non-recoverable, right? So if you're taking some chairs from a room and then you can always reuse those chairs later, that's probably not an unrecoverable supply cost. But, say pens or a uniform shirt for your trainees, things like that, those are going to be supply costs that you're going to want to factor in, because those will recur with every cohort of learners. Marketing, we gotta let people know that our program exists, and we gotta bring in learners, right? So this is one thing where with a partnership, it may reduce your costs, right? If you're getting learners from a program that already exists at a say it's a state college that has a nursing program and you're taking those nurses on their clinicals, like great, that college is going to do the recruiting for those students and you just have to manage that partnership. But if you're starting your own in-house medical assistant and dental assistant training programs, well, you're going to have to find people that want to join those programs. And so you may want to track the costs associated with that, because it may add some burden to the administrative people who are in charge of that and who are reaching out and making those connections and recruiting learners and everything. And so that can be a really major added cost, or depending on the type of program you're running, it could be a pretty minor cost. All right. And then I mentioned administrative costs, right? This is going to be mainly any of your staff that are not the people building the HPEC curricula or directly training, students. You're going to want to still account for things like, say, if you are the HR manager, right, or the C-suite HR leader, the time that you spend on developing this program, you want to account for that, right? Because that's still dedicated to the HPEC time. It may be paid for in a more general budget, but you still want to know how much that's costing per time. Things like IT, right? You may have to set up learners. Say you're doing if you're doing a residency program, absolutely, you're going to have residents who have to be able to chart in the EHRs. So it's going to take time to get everyone set up, right, with their accounts and emails and everything. So you want to take account of that time. And then we're going to have some other costs that we're going to want to factor in that may not kind of fit neatly into any of those previous categories of staff, trainees, resources, admin, or facilities. So we might have specific liability insurance, right? And again, it'll depend on what type of program you're running, but this will be different than, say, like malpractice coverage that you would have for a provider. This would be specific liability insurance, and there are, insurance providers have policies that specifically address learners in kind of real world environments and things like that. So they provide that, right? Like just in case something goes wrong. You obviously want to have that coverage. And then there might be kind of other sundry fees or costs. But if you think of any of these, you're going to want to note them down and note, are they going to be recurring costs or is it a one-off cost, right? And then we have cost offsets. So this is where we're looking at with that resources equation, right? We have kind of what we have and what we need, right? So we just covered all the costs that we're going to incur. And this is stuff that we can gain to help reduce that gap, reduce that financial layout. And so this could be something like, again, state education grants. It could be grants available through federal programs like HRSA is always doing grants for different kinds of health professions training. Could be donations, right? You can solicit donations. It could be in-kind donations, right? So again, time from staff who are retired or part-time that want to volunteer and help train learners. That can be a really valuable thing, or even help, develop a curriculum or something like that. So you can get a lot from in-kind donations. And then other things, again, if you have a partnership, working out who's going to take on which parts of the financial burden can be really important, and kind of having this knowledge of, okay, what kind of funding do we have versus the gap of what do we need is going to be critical as you start to develop those partnerships and really start to negotiate, okay, who's going to cover what costs, right? And then a quick note on building partnerships, since we've talked about that a little already. When you're reaching out to, say, an educational institution or another healthcare organization that you want to partner with, or say a high school in your community, and you want to develop that apprenticeship and everything, you want to make sure that you are providing them with kind of all the information as far as your needs and desires and what this program will do, and then also how it will fill a need that they have. And so this is, the word negotiation a lot of times brings on the connotation of like something that's really competitive, and we get that like car salesman, car buyer kind of thought about it. But what we really want to think of it as is collaborative and kind of building an opportunity that will help both of you, right? And that's how you can even turn something like a hospital that's a competitor for staff and income, and can really turn it into a collaborative partnership is if you think of how can this help both of us, and be able to present that and really convey to the other party, hey, when we enter into this partnership, here's what we're both going to get out of it. And it's going to cost each of us this much, and it's going to gain each of us this much, right? So you want to do research, you want to be very intentional in your outreach, right? If you have staff that have a connection with that other organization, right, you can kind of have those pathways already established, or you may just be doing more of that cold reach out and have leader reach out to leader and say, hey, I think there's an opportunity where we both could really benefit. Let's talk about maybe building this program together, right? And you'll put forward a proposal. We all know how those work. And then you'll negotiate around that proposal again, like how is this program going to look? What's it going to do for each of us? What are each of us going to contribute to it? And again, that can get really in depth, especially as you're really building out that the details of that partnership, and you'll want to have your legal team involved in all of that. And that's its own whole process, right? Is building those partnerships. But ultimately, you just want to set regular check-ins and be very communicative with the partner and say, this is what we need. This is what this program can provide you and what it can provide us, and just be very clear on all of that. It's all about clear communication. And then that maintenance and improvement going forward, right? Because if you're in a partnership, you want to make sure that the partner's getting out of it what they need, you're getting out what you need, and the learners and your staff are getting out what they need as well. And all right, so when we're calculating returns, again, this can be something that for HPEP programs can take a while, right? You have that ramp up, and then you complete your first cohort of learners. They go through, they graduate, yay, everyone gets their hats or their badges or their stethoscopes or whatever. And then hopefully some of them come back and fill staffing positions at your health center. And then you can treat more patients and your revenue goes up, and you're not spending a ton of time recruiting people, and you're not experiencing as big a turnover and everything. But that takes a while to ramp up. So these calculations are probably going to have to be very future looking. And then there are also going to be returns that are very difficult to measure, right? If your staff satisfaction is going up because people really feel good about being able to teach and educate the next generation of learners, people coming into their field, and it's like, oh, good, this person wants to be a medical assistant. I love being a medical assistant. Like, I'm really excited to get to teach and show that I have all this knowledge, and I'm helping them learn and get into the medical field as a career and everything. Like, that can be really great, but it's really hard to measure the return on staff satisfaction. You can do that some with tracking things like turnover, right? Turnover costs us so much. It's sometimes a little mind-boggling to think about how much it costs to turn over one staff member. And so even if you take someone and have them on for 3 years instead of 1, you're really reducing the cost there. I mean, especially for things, so like a doctor could cost, $300,000 or $400,000 to turn over. And so if you're doing that every 2 years, that is a huge drain on your financial resources. But even those more first tier staff positions, like say a medical assistant or, front desk person, or, a nurse or someone like that, they still cost quite a bit to turn over. And so if you're doing that really routinely, if you can reduce that, even by half, then that can be a really huge savings. And that can help to, one, justify these programs, right? If you have to get buy-in from other leadership, other people that have interest in these programs, you can kind of show them, hey, if we can reduce turnover by, X amount, then we will be saving Y amount per year. And that will help pay for, 50% of the program. That can be a huge selling point. But then also for kind of understanding and predicting, like, how sustainable is this going to be? So kind of looking through that. And one of the tools that STAR² does have is our provider turnover tool. And so this is a spreadsheet, and this was designed for physician providers, so MDs, DOs, and then other providers like nurse practitioners and physician assistants. and it has kind of national references in there. So it gives you averages for, say, things like what the predicted HR time is to offboard one person and onboard a new person in those roles. But this is also something where you can put in your own numbers, your own values in for the time costs and the pay costs and everything. And so you can really use this tool to also help estimate for other positions, right? You just have to realize that it's going to work a little bit differently because this was designed around physicians, but I think it can be pretty applicable for other roles. So this is the kind of thing where you can go through and start to really think about some of the nuance of, oh, if I increase staff satisfaction a little bit and I keep 2 people on who normally would have left us, you know, what does that save our program or save our health center? And then there's some other things. Again, a lot of the resources out there are designed around residencies. And there's a link to this, but Capital Link has a decision tree model for funding of projects and just kind of a roadmap for finding that funding. And so I thought that was something that could be kind of useful. Oh, and thank you, Michelle put a link. The links to all of these are in the slides as well. So when you download the slide deck, you can click on where it says source, and that's a hyperlink, and you'll be able to go there. But Michelle has also put the link in the chat for us. And this is a very, I think, systematic process that you can go through, but it does involve a lot of detail and sometimes a lot of decision making on how much detail you want to account for. And then ultimately, and I know at least one of the groups was discussing this, it does come down to, you know, is this doable and sustainable for our health center? Because sometimes the budget may not work out. And I think a lot of times people may forego partnerships that would otherwise allow some of these programs to happen and would help alleviate some of the financial burden. And I think a lot of times they forego them because they feel they don't have enough leverage, enough to offer when they're proposing that partnership. And so just remember that as a health center, you see a really critical, very diverse patient population that's far different than a lot of hospitals see. And so you have a lot to offer a potential partner whose goal is to educate anyone in clinical practice, right? So remember that you have a lot more leverage, a lot more to offer than you think, and really do think about pursuing partnerships that would be appropriate for whatever type of HPET program you're trying to put on, because there are partners for every type of clinical education, from CHWs to nurses to MAs to physicians. So just kind of being creative and thinking and not being afraid to reach out to, you know, potential partners. Okay. Oh, and this is another thing from Capital Link where they have some good sources and everything, but the link is in the source citation there. And then we also have a health provider mix and staffing ratios assessment. So you can go through there and that can help you kind of determine, like, oh, is our staff a little bit more on the heavily burdened side as far as the number of patient contacts they have per day? Or is it a little bit lighter and maybe we have room to, say, do some extra training or things like that? So it's a cool assessment tool. Okay, and then, so I actually, before we jump into this, I had time for breakout rooms, but I just would like to talk to everyone and kind of get a feel for what you all think would be best, because this learning collaborative designed to help all of you as much as possible. So by a show of hands, if everyone knows how to do the hand raise feature on Zoom, who would prefer to have a large group discussion and we can put things into the chat where people can come off mute, and who would prefer to go into breakout rooms? So sorry, that wasn't very clear. Please raise your hand if you would prefer to stay in the larger room here, and we can just facilitate a chat for the last 10 minutes or so. All right, I've got a couple hands. Okay, looks like 4, I think. Okay, does anyone want to go into breakout rooms instead? Okay, and we have another vote for the large group. Okay, I think the large group has it. So in that case, please feel free to either put something into the chat or to come off mute if you'd like, and to share any reflections on what we just went over or any questions that you have for me or for your colleagues.
I'd be happy to jump in, Joan Lane. Shall I jump? Okay. I work at Southwest Community Health Center in Bridgeport, Connecticut. Not to be cynical, but we have a lot of students. We don't have a formal teaching program. I mean, we don't, train groups, but we have many people taking students on a one-to-one basis. And it's wonderful to think that we would be able to give them some time to compensate for productivity, but it does not happen. It's just, it's a corporate decision that's just not affordable. And we, frankly, through a little bit of beating on our corporate leadership, on my part, we did come up with an incentive program. So there's a little bit of compensation, but, I think most of the providers would probably prefer time to a little bit of money, but that's not an option. So I'm curious to know whether other folks on the line, do they give, do they reduce productivity for people serving as preceptors? Because if anybody does, I'd love to hear, I'd love to maybe even pick your brain a little bit outside, but yeah.
This is Dr. Rodriguez. I'm in a health center in Fort Worth, and we currently have pediatricians that serve as preceptors for medical students, and we do not decrease their productivity or give them any extra time. So it's pretty clear from the outset that this is a pretty much on a volunteer basis. We don't force any of our pediatricians to say yes, but it cannot be it can't interrupt your productivity. Can't be disruptive to that. And so the preceptors, the pediatricians just kind of have to figure out how they make it happen to balance some of that teaching with the, with being able to see the patients that are on the schedule. So that, and then we have also students that come in for an LVN program that we partner with, and some medical assistant programs that we partner with, but everybody's still expected to keep up with all of their normal duties while they're, helping to, teach the medical assistants or monitor them, if you will. So that's how we do it.
Do you compensate them in any way, even if it's not time?
No, the pediatricians are actually compensated in one model. They're compensated by the medical school by offering them additional CME stipend money. But the other school that we're contemplating partnering with is potentially, I'm not sure how that's going to work out, but that's how the first one worked out. So the second model's yet to be seen. But we don't pay them monetarily like any incentive pay or any other take-home pay. It's just extra CME money.
And anybody else have any experience with grappling with that?
And I'm curious, and I don't know that we necessarily have an answer right here, but I would be curious to where, like, you can say like your productivity can't suffer if you're going to have a medical student shadow you or something, but it'd be interesting to kind of, if you could in the long-term track, kind of, okay, how many full-time equivalencies for, whoever's doing the teaching, say it's physicians, and look at before they had students versus after, and see if just kind of collectively for a group of people, if there's any kind of drop off or an increase when they don't have students, and be able to say like, well, if we had another person come in for, say, a portion of an FTE to kind of reduce some of the patient load on them, would the increased productivity from the group kind of make up for the slight dip that you see when you have learners. And it may not be exactly applicable to like your medical student scenario, but that would just be something that I'd be interested in kind of asking right in that position.
I think to me, it depends on whether or not you are the one owning the teaching or not. So I think in this particular example that I used, we are not, we are partnering with a teaching institution, right? We are just kind of being gracious and extending our ability to partner and say, hey, we welcome students, and that's kind of the extent of it. But we don't own, like we don't run that residency program, right? So we never hired those pediatricians with the expectation that they would be teaching faculty. So I think it's sort of, from my perspective, I think it depends on how the partnership is set up and whether you own that responsibility or not. I think when you're an academic teaching institution, or even if you had, for example, a residency program that you ran out of a health center, if the health center itself is actually responsible for the teaching, that to me is a very different scenario than a health center that just wants to partner with an academic institution to allow students to come and rotate or residents to come and train. I think that's sort of the difference that I see.
Yeah, I would agree with that. And we don't, like you, Patricia, we don't own the program. We are partners, but some of the programs that we work with, either we have grants with them, or they actually pay us some kind of incentive. And so the program we've developed is if the provider or whoever at the clinic takes a student from a program that compensates the organization, then we pay a small incentive to the provider for taking the student. And we did, Alex, to your point, we haven't really specifically tracked the productivity, which I think would be a good idea, of the providers that take students. But I know our medical director does pay attention to that. And if someone starts to lag as a result of having a student, she won't let me touch that provider for a while until things stabilize. But we actually offer either a small payment. It's $5 per precepting hour. That's just kind of arbitrary. Or they can take it as professional. They can take that as post, taxable income, or they can take it as professional development, which would be pre-tax.
Interesting.
And, it feels good to be able to offer them something, even if it's nominal.
Yeah, absolutely. Because I'd be concerned about, in addition to like, maybe a provider can keep their productivity at the same level. Like in my experience, fairly limited a long time ago, but teaching other EMTs, you can't truly teach and dedicate the exact same amount of time to the patient and fit all those patients into that same set schedule, unless your schedule kind of already had that flex in it. And some people's might, but I'd also be worried about burnout over time. And so, like you were saying, having that rotation kind of on off, especially if the productivity starts to lag, or if you start seeing other signs of burnout, to where it's like, let's try to mitigate stressors. But yeah, it's certainly a challenge if there's no kind of supplemental pay from the partner educational institution for taking on learners. And sorry, Michelle has her hand raised.
Yeah, no, I just wanted to mention, so Alex, you actually said something really similar. So I'm a social worker. When I was training social work students, I felt like I wasn't able to train them properly without an adjustment to my schedule, like that I was doing a disservice to the students, but also understood the productivity side of it. So what I did in the places where I worked, they would adjust, just even if it was an hour out of the day, or just a few hours out of the week, to allow me to really spend that time with that student, and go through with them everything that I needed to do while still maintaining that productivity. So I didn't get paid more, but my hours were very slightly adjusted for that. But I will say in the long term, that was a huge benefit because it helped prevent burnout, and then also people leaving the organization because they just felt too overwhelmed. Even when people volunteer, sometimes I don't think they always realize how much they're taking on. So that balance can be really helpful. And from other health centers that we have spoken with and doing different trainings with ACU, I know some of them, the way that they've revisited their budgeting around this is they've put some of that within what they're budgeting for recruitment and retention, and they're looking at it from that perspective. So even though there would be some loss in productivity, it would already be budgeted in for what they're putting towards recruitment and retention.
Excellent. Thanks, Michelle. And yes, and I certainly, I will admit my bias is from kind of an overburdened system, as far as like your productivity has to be at 100% all the time. And so if you are able to work in a place where your productivity doesn't have to be maxed out every time, certainly you could take on students and not have that dip in productivity or in teaching ability. So I do want to recognize my own bias in that. But yeah, thank you everyone for sharing. And I don't want to keep us over. And so I will just go ahead and wrap up here and let everyone know, just like last time, the coursework for this next session is going to be on the discussion board. Again, if you have any issues accessing that, please email Mariah and we'll get you on the discussion board. And then obviously once you go to the login, you'll see the C-Suite Learning Network 2023. You just click on that, and the homework as well as the slides from today, and then a breakout of the slides with the detailed notes for all those assessment pieces will be on there. So you'll have 3 different things. And then we will see you next month on March 21st. I'm going to have some guests from HRSA and from Ohio to talk about working with both federal funding and state funding. And I believe there should be an evaluation popping up in a second. If you don't mind filling that out real quick for us, that really helps us with our own reporting. And as you're finishing that up, in the slides, there will be all the STAR Center resources as always. And we encourage anyone who's interested to check out our Workforce Success podcast. We have some excellent episodes from this past season that wrapped at the end of 2022. And then if you don't already get our newsletter, here's the link for that. And again, in the meantime, before the next session, please feel free to reach out with any questions. More than happy to help out with anything I can. And once again, thanks so much for being here, everyone. I think it was a really good discussion, and can't wait to see you all next month.
Thank you. Alex, do you mind if I ask you a quick question?
Yeah, absolutely.
So let me turn my video on. So I joined the meeting a little bit late on the very first session. So I may have missed this, and so I apologize if you all address this. But I wanted to just better understand the real purpose of this collaborative is to learn how to create pathways or pipelines, whatever you want to call it, for more sustainable staffing in your organization, and how that can be financially, how you can do that in a way that's financially savvy, and or maybe to capitalize on some opportunities for grants, et cetera, right? I mean, so I guess my question fundamentally is funding only available or primarily available when you as a health center, I say you, we as a health center, are interested in creating our own actual learning programs? Or is there also funding available if we want to just partner with teaching programs? I guess that's my biggest thing, because, you know, as an organization, it definitely would necessitate a lot more, I think, philosophical conversations about whether or not we are really wanting to be in the space of becoming a true learning teaching facility where we run the actual learning program versus, you know, we would love to be a place of training, but not necessarily own the program. So does that make sense?
Yeah, no, absolutely. And so I think my answer would be, as far as the financial piece, like where does funding come from? If you are, if you're running your own program, that's obviously a subset of funding that you're going to specifically apply for, and they pay it to you and you run the program with it. If you're partnering, there are going to be, for like residencies and stuff, especially stuff that's Medicare, Medicaid reimbursable. I don't know the exact details of all of that, but there are very strict funding requirements and everything for how a residency program works, but they can rotate people to other sites. And in almost any partnership, if you, like you said, if you're not owning the program, if you're just receiving learners, that's usually going to be between you and the partner to work out, right? Because obviously a residency program has to pay its clinical instructors. Any program should be reimbursing its clinical instructors. So if you're providing those instructors, it may be that, oh, okay, they get hired on with the partner institution and they clock the time when they're with learners, and that institution pays them, or it might be that that institution gives you a lump sum and you use that to pay for their time, things like that, that would almost certainly be worked out between you and the partner. And there may be some guidelines depending on the type of program it is and where they get their funding that will dictate exactly how they can do that. But usually that's going to be negotiated with you and the partner. And I would say, like, it's one of those things, it's that challenge if you don't want to burn a partnership, but it's kind of like asking for a raise at work. You have a lot to offer, right? And you as a health center are very valuable to their learners' experience. And so remembering that it's appropriate to say we need appropriate compensation for the work we're putting in and to keep our staff, because otherwise you're not going to be able to send students here eventually because we're going to have burnt out all our staff. And so really, having that conversation, it can be challenging. And so that's where that pre-planning and deciding who's going to have this conversation and everything is going to take place. But yeah, I would say advocate pretty hard with the partner organization to say, like, we should receive appropriate reimbursement.
Yeah. So pretty much all that funding or I guess, whatever money will go to the program that owns the teaching program.
Generally,
versus,
yes.
Okay.
Yeah. And they may be able to like contract some of it out, right? If you receive a grant, sometimes you can pay a portion of it to subject matter experts or contracts or whatever to do that. So they might be able to do that. But usually, the granting organization wants that single funnel, and then afterwards they're like, just account for it. And so, yeah, a lot of times it's not to just take on learners from other programs. You would need to in some way own the program.
Yeah. Okay. Thanks for clarifying that. That's
Absolutely.
what I felt was accurate. I just didn't want to make assumptions, but yeah, I appreciate you clarifying that.
Yeah, absolutely. And it's one of those things too, if you decide you have a more vested interest, if there's a partnership between two organizations saying they collectively apply for a grant, then it may be that, you split that funding.
Right.
And so things like that, but it would be something that, you would work out with the partner.
Got it. Okay, perfect. Thank you so much.
Yeah, absolutely.
All right. Well, I certainly look forward to the next session is definitely,
Excellent.
I think, going to be really awesome. So thank you guys.
All right. Thank you so much.
Okay. Bye-bye.
Take care.